The state of Louisiana has plenty of room for improvement when it comes to America's yearly health rankings report. We ranked 50th this year, everybody. Today, we are learning more about the results, why we came in last place, and what this means for our overall health. Joining me now virtually is Dr. Denise Leonardi. She is the Senior Medical Director for UnitedHealthcare. Thank you so much for being here, Dr. Denise. I have so many questions for you, but first, let's talk a little bit more about this report. What did it look at?
Well, the report looked at overall health rankings across the United States. And basically what we have seen this year in 2023 is that 8 chronic conditions have reached the highest rate of prevalence in the report's history: arthritis, asthma, cancer, cardiovascular disease, chronic kidney disease, chronic obstructive pulmonary disease, depression, and diabetes. This report, as you may or may not know, is one of the longest running state-by-state analysis of our nation's health. And it is designed to help guide action to improve health and well-being of our communities, as well as spark some timely discussions about solutions to some of these urgent disparities.
Yes, like the one we're having today. You know, this report was produced by the United Health Foundation in partnership with the American Public Health Association. Like I mentioned, we came in 50th, everybody, last place. What are some of the numbers that stood out to you when it comes to Louisiana?
Well, some of the numbers that stood out to me is diabetes prevalence had increased across the country to 11.5%, impacting nearly 31.9 million adults. And in Louisiana, this prevalence was even higher at 14.2%. In addition, depression prevalence increased across the country to 21.7% in the adult population, affecting nearly 54.2 million people. And in Louisiana, it was over 25%. In fact, it was 26.7% of adults in Louisiana are struggling with depression.
Wow, and what I appreciate about this report is that you all break down the numbers, but you also divide each state into what some of the challenges are and what some of the strengths are. And look, we do have strengths, everybody. It's not all negative here, but let's highlight those challenges. What did you all find as Louisiana's challenges in this report?
Well, some of the challenges that we saw are high premature death rate. Louisiana was ranked 47th, and then a high economic hardship index score, and we were 49th. Some of the number of homicides in Louisiana ranked 49th, with 19.6 deaths due to injuries inflicted by another person with intent to injure, and a low prevalence of high school completion. However, it's not all bad. Some of the strengths, Louisiana ranks 7th, with 7.5% of adults reporting ever being told by a health professional that they had any form of cancer other than non-melanoma skin cancer. And this is down, which is, overall, melanoma is down. National average was 8.3, it's down to 8.1%. The other thing I think that is really noteworthy is low non-medical drug use. Louisiana was ranked 16th, with only 12.5% of adults reported that they are using prescription drugs non-medically, which includes pain relievers, stimulants, and sedatives. The national average is 15.9%.
Wow, so we do have some strengths, and I also saw in there as well that we had low black-white residential segregation and low levels of air pollution. So again, it's not all bad, everybody. We do got some great things going on in the Pelican State. But I gotta ask you this, we still rank 50th, Dr. Denise. How are local leaders, policymakers, even healthcare companies like yourself trying to help us with this number? Because it's really bad.
You know what? It is, and nobody likes to be last. But really, we urge leaders and communities to engage in these data-driven discussions about solutions to the challenges revealed in this report. And I do know there have been some initiatives. United Health Group has a range of partnerships and programs that offer some emerging best practices to improve health for its members. Last year in 2022, United Health Group announced a zero copay for insulin, as well as albuterol for asthma and other specific expenses, drug expenses. So by eliminating out-of-pocket expenses for these critical medications, we can reduce the burden of medical costs on consumers so they don't withhold getting their medication.
No, it's so important, and I appreciate that you all are doing things to really help with those costs and try to help us get to a better place, because we're 50 now, but hopefully next year we can be 45, 40, until we're #1. I want to thank you, Dr. Denise, for joining us today. And look, everybody, if you want more information about the American Health Rankings Report, you can see the full report by logging on to americashealthrankings.org. And for more information about what UnitedHealthcare is doing to improve these numbers, head over to uhc.com. And stick with us, everybody. We'll be right back with more music. Holiday time is here. We'll be right back.